Credo Mobile fights hard to enact progressive change and defeat regressive policies. Majority Report viewers can get up to $350 credit towards switching to the only progressive phone company. Go to credomobile.com/Sam right now. There's two stories this past week. One was from a couple of weeks ago about the medical device tax. We heard quite a bit about the medical device tax in the debates about reopening the government and raising the debt ceiling. Understand that the medical device tax was set up as a clawback. If you sell medical devices because of the Affordable Care Act, you're going to get a lot more clients and a lot more customers. And as such, you're going to be making a lot of profits on top of the already obscene profits you're already making. This was a way to finance some of the subsidies, and so a device tax was added. The medical device industry faces virtually no price competition. Why? Because of confidentiality agreements when they sell to hospitals, nobody knows how much other hospitals are paying for. So they don't really have a sense of whether or not they're getting a good or bad deal. Plus, manufacturers develop relationships with doctors. These doctors are the ones who tell the hospital, who's paying the bill, to buy these devices so that the doctors can perform procedures with these medical devices, get an increase on their revenue, subsidized in part by the hospitals, from buying these medical devices, which are ultimately subsidized by all of us. So this is just a way for everybody to make money. Physicians don't even know the cost of these devices. They just know that they get paid more when they do these procedures. The Government Accountability Office found that the prices for cardiac implantable medical devices in the United States vary by several $1,000s, and even the lowest priced devices in the United States are expensive compared to those in developed countries. In fact, according to McKinsey & Company, the United States spends about 50% more than expected on the top 5 medical devices compared with Europe and Japan. 50% more. McKinsey calculates that this amounts to $26 billion in excessive spending each year. $26 billion. Medicare, private health insurance, and patients ended up paying these inflated prices. The device tax is so small relative to the profit margin of these companies because they're selling such inflated devices with such inflated prices. In the case of Johnson & Johnson, in 2012 had an operating profit of $7.2 billion. The device tax would amount to, at most, $300 million. Its investment in research and development amounts only to $1.7 billion. They're just raking in the profits. There are ways you can deal with this. You can stop the anti-competitive practices, open up transparency on how much these things are costing hospitals from hospital to hospital. Medicare should also pay hospitals a single lump sum for all the associated costs given to a problem that a patient has rather than piecemeal on all the different things that the hospital throws at it. It's known as bundling, and it's successful in test and pilot programs. The other is the Patient-Centered Outcomes Research Institute. This is created by, sometimes they call it PIABA, created by the Affordable Care Act. This basically measures the comparative effectiveness of the use of these devices because inevitably, if I'm a doctor, I've got my hospital to pay for, or I've bought my own big medical device, guess what? I'm going to use this for everything because I charge a markup every time I turn the switch. Another example of this story, there was one about the hip replacement that the Times did, I don't know, a couple of months ago. About a guy, he went, I think it was in Switzerland, and he stayed at a luxury hospital, got a hip replacement, still saved tens of thousands of dollars of what he would save in this country, which is why we're seeing more and more of medical tourism outside of the States. Story just last week, the rate of spinal surgery at hospitals that purchased implants from physician-owned distributorships. These are doctors who own the local franchise for blankety-blank medical device, grew more than 3 times as fast as it did at hospitals overall. The agency also found hospitals that purchased implants from PAWS performed 28% more spinal surgeries than hospitals that didn't. I think there was a big story today that showed we're doing this fusion surgery far more than should be. It's not effective 50% of the time. But it's a go-to. When you're a hammer, everything's a nail. And this is driving up the cost of medical care. So you can forget about insurance for a moment. Yes, we know Medicare is 17% now, probably more, but on paper, 17% more efficient than private insurance. But at the end of the day, if the cost of medical care continues to rise, it doesn't matter how much efficiency you squeeze out of health insurance, because the costs are just going to continue to go up for what health insurance pays for. And the only way, really, ultimately, at the end of the day, we're going to get control over this is to have a universal single payer of health insurance that can get a grip on exactly where the overcharges are coming from and cut down on payments there. You just basically say, we're not going to pay these rates. And so either you're going to have no customers or you're going to make a less of a margin on volume. That's the bottom line.